Okay, so once again, good morning, students. So today we will be revising on the topic of ascites. So from the picture itself, uh, we can see that this is the normal abdomen and this is the ascites abdomen. So a normal abdomen is like that, and ascites abdomen, something is filled up inside the abdomen. So we will discuss about that. What is the difference? I mean, what is it actually? This ascites. So ascites, it usually occurs when the fluid is accumulated in your abdomen. Okay, means some fluids are there inside your abdomen. So when fluid is filled up in the abdomen, it is known as ascites, and it is the abnormal. It is the abnormal built-up fluid in the abdomen. Means what? I mean, obviously it's not normal. It's not like excessive fluids are there, which is not even required, which is not even necessary for your body or else for your abdomen. So that's why it is known as abnormal. It is built up. Built up means what, they are growing, like the fluid which is in the abdomen is growing abnormally. That's why it is said built up abnormally. It's not normal. That's why. Is it clear? Excessive fluids are there, which is not normal in the abdomen.
Yes, ma'am.
Okay. Okay, next is causes. What can be the cause for this ascites? Yes. So, uh, first is we can find that it is mainly because of cirrhosis of liver. So, liver, what does it do? Metabolism. It metabolizes. It's not it. So, this liver, what do they do? I mean, in the liver, what happens means mostly for this ascites, it is like it is in this cirrhosis of liver. What happens in the liver? There is blockage of blood flow. I mean, whenever there is blood flow in the liver, na, like there is to be blockage. The blood circulation, or you can say that means there is no proper blood circulation. There is like a blockage. So that's why it usually occurs, and mainly it's also because of acute liver failure. And ultimately, what will happen if there is blockage in the means liver, means blockage of blood in the liver? What will happen? There will be failure, means the liver will fail to function. So that's why it usually happens. So you will find some stages of liver damage. That is, first is fatty liver. First, some fats will be deposited. I mean, some fats will come in the liver, and as a result, what will happen? The liver will get enlarged. The liver will get bigger in size. Obviously, if it's additional, right? Like the fats are being added, means the fats are added in the liver. So that's why obviously there will be the liver will increase in size. There will be some enlargement. And next thing what will happen, because of that, liver fibrosis will happen, means scar will form, like mm, some scars will form like tissues in the tissues. And after that, what will happen? Ultimately it will lead to cirrhosis. In cirrhosis of liver, what will happen? There will be the liver, na? In the liver, what will happen? You will find some tissues, so all those tissues will be destroyed. So this lead to liver damage. Is it clear? It's mainly because of liver, this ascites.
Yes.
Yes.
Okay. And next causes might it might be can because of cancer, abnormal growth of cells, and nephrotic syndrome. Okay. So means sodium level it increases. So that's why nephrotic syndrome occurs. So these are some of the causes of ascites. Okay. Next is risk factors. So these ascites, who are like at the risk of having ascites, who are mostly at the risk of having ascites? First is exposure to hepatitis. So how can a person get hepatitis, especially hepatitis B? Okay, A B. that B, that B letter. Okay, so this hepatitis B, how can a person get hepatitis B? First is practicing unsafe sex. So if a person is having some unsafe sex, say for example, not using contraceptive devices, say for example, all these condoms, then pills and all, no, eye pills and all. So if a person won't have all those, what will happen? They are at the risk of having this hepatitis B, that is practicing unsafe sex. The next is remaining unvaccinated for hepatitis B, means uh, if a person won't get vaccinated, you all are taking vaccines now, right, for this COVID-19. So same like that. So whoever are not taking like all those kind of medication, not medication, sorry, vaccine for hepatitis B, so they are at the risk of having this hepatitis B. The next one is drug use, means whoever are taking some drugs, no, like mostly who are sharing like needles and all. Whenever a person takes drugs, what happens? They mostly, it used to be taken by the young people, like teenage and all, like in order to experience it. They usually takes that because of peer pressure. So what do? Like they sit together and they share the needles together. So those sharing of needles also, like they are, like they can have hepatitis B. Not only that, in even in hospitals also, like maybe because of some carelessness, uh, like they can give na, like they can share the needles. So in that way also, like a person can have hepatitis B, like sharing of needles. Okay, so these are some of the reasons. I mean, not reasons actually, like these are some of the risk factors of ascites. And the next is heavy or frequent alcohol use. If a person drinks too much of alcohol, so they are at the risk of having this hepatitis B. Or else you can say ascites. So they can have ascites. Next is certain medications that may cause liver damage. So if a person uh, have all this kind of like medications, some medications are there, so which causes liver damage and ultimately it will lead to ascites. Next is chronic health issues. It might be because of some health issues also, like say for example heart failure, then kidney disease, all this. So all this might also be the reason for this ascites. So these are some of the risk factors, like who are most likely to have ascites. And some already this one is discussed, consumption of alcohol. And next is low protein diet. If a person uh, consume or have a protein diet, I mean low protein diet, so they can have ascites. Next is weakness and fatigue. If a person is too weak, no, they can have this ascites. Is it clear?
Yes, ma'am.
Okay. Okay. So this is like about alcoholism. It's not included, but still, I just want to share with you all, which is like in alcohol. If a person have alcohol or else addicted to alcohol, so um, that alcohol can like affect like your organs, okay, your internal organs or else visceral organs. So what are those? It affects your liver first of all, which we have already discussed right now. It affects your liver as well as your kidney also. It affects. And next is damage to brain function. Brain function means what? Mostly nervous system. So it affects that also. Next is chronic heart failure. It affects your heart also. So these are some of the what to say, side effects which are mainly caused by having alcohol or else addicted to alcohol. Okay, next is treatment. How can a person prevent himself or herself from not having this ascites? First is abstaining from alcohol, means a person should not have alcohol, should avoid alcohol. And also the next point is consumption of low amount of salt. uh, the person should have low amount of salt, means sodium chloride, no? All those sodium, all those they should consume low means in comparison with the previous amount of salt whatever they were having, they should lessen the amount of salt intake. Is it clear? I hope it's clear.
Yes, ma'am.
Okay, next is synthesis, or else you can say ascitic tap. So this is some like method. This is some method which a health practitioner performs. It's not like anyone can perform it. Some health professional people can perform. So okay, this is ascitic tap. It's also known as ascitic tap or parenthesis. Okay, so what is usually done here? Here in the abdomen, no? Means in the where the fluid is accumulated in that abdomen. What do? They take out, means they draw out. They draw out the excessive fluid. Whatever is there in the abdomen, they take it out. And this paracentesis, it is mainly done. It is mainly done because of two reasons. First is diagnostic. In order to diagnose the condition, means whether the condition, that ascitic problem, no, that condition is severe or else moderate or else mild. Okay, mild, severe, moderate. So in order to detect, in order to know the severity, or else you can say in order to diagnose, in order to know the condition, the the main reason, it is mainly done in order to diagnose. Next is therapeutic. Therapeutic means what? In order to treat, like if by knowing the condition, by knowing the stage, that is mild, severe, mild, moderate, severe, in order to know the condition, uh, according to the severity, according to the severity of the person's condition, like how it should be treated. So it is mostly done because of these two reasons. First is in order to diagnose, like whether it's severe or else moderate or else mild. This or else in order to diagnose, in order to how to this one, in order to know the severity. It is mostly done. And second thing is therapeutic. Therapeutic means how to treat. If it is too much severe, like what medication should be prescribed, how they can treat. If it is mild, then not that much medicine is required, or else treatment is required. So in that way, like they will know. Okay, so it is mostly done for these two conditions. Is it clear?
Yes. Yes.
Okay. Okay, next is how it is done. I mean, how a person or else how a patient should be placed. We will discuss it. So obviously the person like should lie down. This is just a standing position. Actually, they should not stand up. They should lie down on the bed. So this is your stomach. This is your bowel. This is your liver. This is the peritoneal membranes, means peritoneum, and this is your rectum, and this is ascites, means fluids, means abnormal fluids is accumulated in the abdomen. So they usually insert the pipe. They usually insert the pipe, and this is the like catheter. This is the catheter, and this is a drainage catheter. Okay, drainage catheter. Drainage means what? Means all the unwanted particles, all the unwanted things. They, I mean, they take out. So what are the unwanted things here? Obviously, it is the fluid, excessive fluid. This is the abnormal fluid, correct? So this is the like abnormal one, okay? And this is the drainage container. Like they can see the container, means drainage container. There are some markings where you can see like how much ml, like you can know like the how much how much amount of fluid is coming out from the abdomen. Okay, so these are some this is the method. This is the method on how to use this abdominal parasympathesis. Is it clear, everyone?
Yes. Yes, ma'am.
Okay, if it is clear, then let me ask you some questions. Virginia, Virginia, can you hear me?
Yes, ma'am.
Okay, ascites. What do you understand if I say ascites?
Pardon, ma'am.
What is the first thing that comes to your mind if I say ascites?
Ma'am, I
Yes.
don't know, ma'am.
Uh-huh.
Hello, ma'am.
Yes, I can hear you. What?
Can you
Can you
repeat it,
answer?
ma'am? No, ma'am.
No. Okay, Philisha, can you answer?
Yes,
Philisha,
ma'am.
can you answer?
Yes, ma'am.
What do you understand if I say ascites?
Uh, it is the abnormal build-up fluid in the abdomen.
Okay. Okay, good. Okay, next question goes to Salan Girija Devi. Salam, can you hear me? Salam. Okay, Darshana, can you hear me?
Yes, ma'am.
Okay, Darshana, can you tell me some causes of ascites?
Cancer, nephrotic syndrome, acute liver failure,
Okay, okay, good.
due to CIRRH4SIS
Cirrhosis.
cirrhosis, there is a blockage of blood flow in the liver.
Okay,
Cirrhosis of the liver is most common causes of acid.
okay, okay, good. Okay, the next question goes to Hemam Shelly Devi. Okay, Hemam, can you tell me some of the risk factors of ascites?
Consumption of alcohol
Mm.
and
And anything else?
safe sex, drug use,
Uh-huh. Unsafe sex.
certain
Okay.
medication sleep limits.
Okay. Okay, good. And also who are not having and also who are not
Unvaccinated.
having this one means unvaccinated, who are not taking vaccine for hepatitis B. So they are mostly at the risk of having this. Okay. Okay, I hope everything is clear na, about ascites.
Yes.
Yes.
Okay, can you see the screen, this one?
Yes.
Yes, ma'am.
Okay. Now let us see about the structure of nephron. Okay, so this is the structure of nephron. So let me show you where the nephron is exactly located. So you will find inside the kidney, you will find there are about 1 to 2 million number of nephrons. So we have discussed the three areas of kidney, right? First is capsule, cortex, medulla. Capsule is here, and cortex is the second, and medulla is the third. So you will find if you will look closer under the microscope, so you will find that there are about 1 to 2 million number of nephrons. So in where it is exactly located, the nephrons? So they are in the areas of the cortex and the medulla. So this is the cortex and this is the medulla. So they are located in these two areas. Okay, is it clear? Clear or not? Okay. So now let us see the structure. I won't discuss about the function because it's not my part. Plus the structure. Moreover, you have asked me about the structure, so we will discuss about the structure. Okay, first is afferent arteriole. Sorry. So first you will find the afferent arteriole, and next is efferent arteriole. So this is the efferent arteriole, and here you will find the Bowman's capsule. Which one is clearer, here or here? Which one you will find like clearer? The first one or this one? Huh? First one or this second? Where in which picture will I explain?
Yes,
Huh?
ma'am.
What, first or second?
Ma'am, this.
This one.
First one.
I'm not saying first, someone is saying second. Okay, I'll explain from here. Okay, so this is the nephron. So in the nephrons, what will you find? You will find that like the structure is like this. Okay, the structure is like this, and if you will look closer in the glomerulus, first you will find the glomerulus in the nephrons. So if we will look closer in the glomerulus, what you will find? First, you will find the afferent arteriole. So this is the afferent arteriole, and you will find that the afferent arteriole, even in the size also, it's a bit bigger compared to the efferent. Why? Because all the blood is like coming from here, right? So that's why mm, if our afferent arteriole is bigger in size, like in diameter also it's bigger. Okay. Next is you will find the glomerulus. So this is the glomerulus, and the glomerulus they are covered by this. That is the Bowman's capsule. So this is the Bowman's capsule. And inside the Bowman's capsule, you will find the glomerulus. Then you will find the efferents arteriole. Efferents, you will find that they are smaller in size compared to the afferent. Okay, means actually the blood is already being purified. So that's why efferents arteriole, even in filter also you see, like the filtration part used to be a bit smaller in size. The same thing, even in the efferents arteriole also, you'll find that their size is smaller in comparison with the afferent. Okay. Okay. Next is proximal convoluted tubule. So this is a proximal convoluted tubule. So why it is known as a proximal? Because the glomerulus is nearer. It's near compared to the the glomerulus is nearer. So that's why it is known as the proximal. Proximal convoluted tubule. Convoluted means what? They are twisted in this way, right? They are not straight. They are convolved. They are twisted like this. So that's why it is known as proximal convoluted tubule. Also, it is known as PCT. The abbreviation is PCT. Okay, next is descending loop of Henle. So this is a descending loop of Henle. So in the descending loop of Henle, they are the loop like a U shape. So that's why they are descending loop of Henle. Next part is the ascending loop of Henle. So this is the ascending loop of Henle. Okay, and if we will go further and further, what you will find? You will find the distal convoluted tubule. Distal, why distal? Because it's far from the glomerulus. That's why it is known as distal. Convoluted means convulsed. They are twisted. So that's why they are convoluted tubule. Tubule, why? Because they are like a tube. T-U-B-E, tube. Right? So that's why it is known as tubule. Okay, it is also known as DCT. And the last structure and the last part is the collecting duct. So this is the collecting duct. That means whatever like process is done here, whatever function they are done here, and it is usually taken by the collecting duct. So this is the collecting duct. Okay, so in this way, you will find this one, nephron. And in all these places, now, let me show you. In all these places, you will find the peritubular capillaries. All these other capillaries. Okay, all these other capillaries. The nephrons you will find. So this is the structure of nephron. Are you clear? And the Bowman's capsule, they are like a cup, CUP cup. Their structure is like cup. It's not it. From the picture itself, you can say they are like a cup. So they are shape or the structure is like a cup. I hope everyone is clear now. The structure of
Yes.
nephron. Clear, na? Clear or not?
Yes. Okay.
Okay. Okay, it's good then. If everything is clear. Okay, next topic what we will discuss. I mean, next day. Which person? What topic we will discuss? Which person? Can you hear me? Excuse me. Surajit, can you hear me? Surajit Kalita. Okay, Sheetal, can you hear me? Am I audible? Alright, none of you can hear me.
Yes, ma'am.
Yeah.
Okay, Sheetal, what topic we will discuss next day?
Ma'am, superficial thrombosis.
Vein thrombosis.
Yes, ma'am.
Okay. Okay then. That's all for today's class. On the next day, we will discuss about this.